Hi, everybody. Somebody asked a good question on one of my recent videos, and well, actually it was a video that I posted on YouTube, a video recording of the interview that I had with Dr. Jill Krista. We chatted maybe a month and a half ago. I posted the video on YouTube. I don't know how long ago, anyways, a week or so ago, something like that. And it's a really great interview. One of the comments that the person made was that she said, I nearly collapsed when Dr. Krista said mold wants to compost our bodies. And that is true. It's so creepy, but it is true. That is what mold does. It's the great, nature's great composter. So I know for me, until I'm pushing up daisies at some point, I definitely don't want mold composting me, which is why if I'm ever in a, damp smelling place, a musty place, a place I know that might be mold contaminated, which I try to avoid, but sometimes you can't. I'm definitely preemptive, using, getting on my binders, using my nasal spray before and after that exposure, because I really don't want any mold in my body. Anyways, after expressing appreciation for the Dr. Krista interview. This person mentioned that they've lived in had lived in a mold contaminated place. They've since moved out, and let me just expand this here so I can see the whole shebang. But the person said that so sinus issues and brain fog are the main problems. There's still red eyes happening. The person's using X-Clear, which is a xylitol-based nasal spray, clay and charcoal, and then asking, is that enough? It's a great question. As per usual, I can't give any medical advice over social media. This video is for informational purposes only, and I'd encourage anyone listening to make sure that they, if they need medical advice, to talk to their clinician to get that medical advice. But I can comment kind of just generally on this concept of, is a protocol enough? That's a question that I ask myself all the time, whether I'm the one who's prescribed the protocol, whether a patient's coming in and they've been working with other clinicians and they're on protocols, asking the question, is that enough? And the litmus tests for that, there's kind of a clinical litmus test and there's more of a objective litmus test. The clinical litmus test is if a patient comes in saying, for example, they've been, maybe diagnosed with SIBO and they're on this or that herb and they're doing this or that diet, and they say, is this a comprehensive treatment? Well, then my clinical assessment of that is, well, how are they doing? How have they improved? Are they continuing to improve? Have they hit a plateau? What's the rate of improvement like? And if a patient's improving too slowly or they have hit a plateau, then my answer to that question would be, it looks like this is not a comprehensive enough protocol, or maybe it was good before, but we need to evolve it to something different. And then the other litmus test, more on a more objective level, would be, what does laboratory testing say? So if I had a patient who, say, was had an issue with Bartonellosis, and they had done an Armin Labs test, an ELISpot came back showing, say, a sensitivity index of 15 for Bartonella, and they had symptoms that were in line with that, had them on an herbal protocol, and say they come back a couple of months later and say, so am I on enough of a protocol, a comprehensive enough protocol to treat my Bartonellosis? Well, in addition to those clinical factors, I could say, well, we could redo the Armin test and let's see what your sensitivity index is now, and go from there. Now, maybe that's not the best example because we generally want to leave a good 7-week window to see how well to see how much a lab result has changed when there's an ELISpot. But anyways, the gist of it is that we can do objective follow-up testing to see if things are changing as well. So clinically, are things improving too slowly, or has the person hit a plateau? Objectively, have the lab results changed? Did that sensitivity index go from a 15 down to a 10, 15 down to a 0? Did the bacteria that was overgrowing on the stool test and for another patient go away, or the numbers looking better, or are there less pathogenic species present now? So these are things that we can take a look at. So if the answer to those questions is no, then it may be that the protocol was comprehensive enough at one point, but is not comprehensive enough now, or it's just not a comprehensive enough protocol. So thank you for the question, and thank you for the feedback on the Dr. Krista interview. If anyone listening has not listened to the Dr. Jill Krista interview, please do check it out. We talk about more than just mold. She's well known for her expertise in mold illness and mold toxicity, but we talked about a number of other topics as well. She's just a great person to listen to, very caring, compassionate clinician, and it was just a really great chat. And that is available on my YouTube channel. It's also available if you want to listen to it in podcast form on any of the podcast platforms that you may utilize. Just look up the Overcoming Chronic Illness podcast. That's the name of my podcast, and her interviews on there with a couple of other ones, and more to come, more exciting guests in the wings. Thank you again for the question. If anybody has any additional questions or about this topic or anything else, just post in the comment section below, and I'll do my best to answer as soon as I can.